Welcome back. This section is still about self-assessment, but in relation to prioritizing your needs now that you've assessed what they are. Now, it's not uncommon for most new professionals to struggle with self-assessment on the job because there's a lot to learn. Consequently, some of you may feel like every area on that previous handout rubric report is a priority for you to learn right now. However, rather than feeling like everything is a priority, you can also start by focusing your attention on the most important support you need by using the environment you want to work in as a filter. For example, if the site you want to work in is a federally qualified health center, then you're probably going to need to learn how to do a lot of documentation really well. So maybe that's what you should focus on getting more support around now and in the future. After all, the most effective strategies are tailored to address the realities you're most likely going to encounter in the workplace. Furthermore, we all know that challenges a CNS would encounter in a practice community will be different than those faced by an FNP. Likewise, the challenges faced by an APRN working in a community clinic are different than those faced by APRNs working in hospitals. Therefore, it's important to not only assess yourself, but also be familiar with your practice environment so you can better prioritize the type of support that you'll need. Let's see what our alumna Michelle has to say on the topic.
I can imagine if you're working in a more private practice type place where you are the sole provider at any given time, then your concerns are going to be less about autonomy and being in a provider role in the way that we think we're training for, but more about hours, number of patients seen, expected time frames, note writing, that sort of thing. Whereas working in a larger institution, the concerns that I hear more about are we utilized in the way that we're trained? Are we practicing to our full scope? Are we looked at as equals to our peer, our physician colleagues or our PA colleagues? Are we practicing as independently or autonomously as possible with our skill set or with our knowledge and experience at that time? And depending on where you are, the issues that rise to the top are going to vary. But in terms of the extremes, those are probably the two most common things that I hear.
All right, so to recap, as new professionals, many of you are still gaining confidence and growing into your new roles. So in assessing yourself, it may seem like you need support of all kinds, but we need to focus on some key areas that can be prioritized based on your environment as well as your skill levels. So, for example, a CNS might find that because there is a variety in understanding and utilization of the CNS role in practice settings, one of the things that a CNS might choose to focus on in terms of support is assessing whether there is a clearer understanding by the practice community staff of what a CNS is and does, and or making sure that there are other CNS on staff that are there to help guide them. If you're a midwife and you're worried about collaborative relationships between physicians, maybe you'd want to focus on negotiating interprofessional check-ins with the staff to build stronger relationships in the beginning. So now it's your turn. Take a look at the prioritizing and strategizing support handout in your practice environment. And first, you'll identify differences in various practice environments. Next, you'll flip the sheet and work on filling out the other side, where you prioritize your needs according to what you understand the challenges in your environment to be given your skill level. Lastly, once you've prioritized your support needs, the last column is for you to create a specific support plan for your highest priority skill. You could create specific plans for each area of support you need in the future, but today we're just going to practice doing one. And we'll see you in the next video section after you're done.